Dr. Catherine Roxanne Growie was an Ohio plastic surgeon who caught the attention of the state medical board after it was discovered that she had been live streaming patients' operations on TikTok and other social media. The state medical board permanently revoked Growie's license to practice medicine in Ohio in July. The dispatch spoke with Beth Benadum, one of Growie's early former patients, at her Dublin home. Here's that full conversation.
So I have a family history of breast cancer, and found out in September of 2012 that I was BRCA2 positive, which meant I had an 87% chance of breast cancer. I had an oncologist that I've seen for years, again, because of my family history, and she strongly recommended a mastectomy, and I didn't want to do it. And I will say I didn't want to do it. This is important to the story because I didn't want to wake up with no boobs. I didn't want that to happen. So about a year or so later, she actually connected with Dr. Growie through Mount Carmel and introduced me to her. And Growie at the time was doing immediate reconstruction. So you would have a mastectomy, and in the same surgery, then she would come in and do implants. So it wasn't waking up with nothing and then having to do sizers and all of that sort of thing.
I didn't even know you could do that.
Yes, you can. So I was like, okay, I will do it because I won't wake up with nothing. And I still wasn't thrilled, but I went through with it in April of 2014. I had a bilateral prophylactic mastectomy, and Growie did the implants, spent a night in the hospital, everything seemed to be fine. So then over the course of the next couple of months, the left side just wasn't healing. So in June, so it only had been about 2 months, realized that I had an infection on the left side. Went into Growie's office. She was on vacation, so the nurse practitioner looked at me, agreed that I had an infection. They sent me to a different surgeon who talked to Growie on the phone, and she told him that, and a lot of this is going to come back full circle. So she told him, no matter what, take the implant out, wash it, put it back in. And because she knew I didn't want to have anything. That's what I believed at the time is the reason that she did it. So he did that surgery while she was on vacation. I did a follow-up then with her, and within another several weeks, it was infected again. Implant has to be, then she used a new implant, did another surgery, did a new implant, put that in, and then again, it got infected. So at that point, she couldn't put anything back in. She couldn't get rid of the infection. So this is where I like to say that God has a sense of humor, because instead of going with no boobs, I only had one. So I had to go 6 months with nothing. And because she couldn't figure out the infection, I had to go to an infectious disease doctor and had a PICC line for 6 months, or for 6 weeks. So had to give myself IV antibiotics for 6 weeks. So then, comes the beginning of the year, and
so it's 2015.
So now it's early 2015, and I vividly remember this. It was Groundhog Day, or no, I take that back. Now it's January. We do surgery. I've been about 6 months with nothing. She puts the left implant back in, and it, within a couple of weeks, got another infection. And I remember it was a Sunday morning. I called my oncologist on call, and I said, I don't care what you have to do, get me in somewhere, get this out of me, like she's never touching me again. And the next day was Groundhog Day. So that was like the running joke, is it's Groundhog Day all over again. So so a surgeon then took the implant out, and then my oncologist referred me to another surgeon to try something else. So again, I had to go another 6 months with nothing. And then in September of 2015, I had what's called DIEP flap. It's DIEP. and they do basically do a tummy tuck and take that fat and transfer it then to do the reconstruction on the left side. And so they did that, and I was in the hospital for a week because it's very
Sounds more
invasive, intensive surgery, and then had to have another surgery for them to do just kind of the revisions from the tummy tuck and the reconstruction. But ultimately, then in April of 2016, then everything was done. So 2 years, start to finish.
Wow. And she didn't do that last procedure.
She did not do those last ones. I fired her in early 15 because she kept telling me that, oh, it must have been something at the hospital, or oh, this never happens, that kind of thing. And I wanted to believe her so badly. And then I couldn't ignore it anymore when I'd gone 6 months with nothing, and then now you've given me another infection. Like, you are the common denominator. It has to be you. And then I believe not long after that, sometime like 15, 16, 17, somewhere in there, she lost her hospital privileges, is my understanding, because she was doing a bunch of surgeries at St. Anne's and constantly had infections. So she lost her hospital privileges, which is why she did the surgical suite in Powell.
So it sounds like you kind of started to realize that something was up back in, did you say 2015 probably?
Yes.
2015. What, obviously a lot's happened since then. When did you start connecting the dots kind of beyond what had happened to you, when you started realizing like, holy crap, this woman's doing this to a lot of people?
Well, so I heard she'd lost her hospital privileges. And I heard from, when you start having all these procedures, you have similar nurses, you have similar facilities. Oh, I know the other dot I didn't connect for you. So when I had my revision surgery, after I had the DIEP flap, I had the revision surgery at a surgical center in in Arlington. And so my surgeon who had done the DIEP flap was doing this revision. And I was in the back in the prep area, waiting to go back for my surgery. And I hear this, knock, knock, can I come in? And it wasn't my doctor, but I recognized the voice, pull the curtain back, and it's the guy who did my original replacement. And he said, I saw your name on the schedule today and I couldn't believe it was you. That, 2 years later, this is still going on. And he said that he had regretted putting my implant back because the infection was so bad, but Growie insisted that he do it. And he said, you were her patient, I deferred to her, and he said, and I have regretted it ever since.
Oh my God.
So it was just like this
odds?
Full circle. So it was things like that. It was, again, seeing Mary's story and knowing that it had happened to her, hearing that she'd lost her hospital privileges, hearing from my oncologist that she knew of other patients, hearing from the doctors who did the last reconstruction on my left side that they knew of other patients. It was just all these. And I didn't have any idea that she'd blown up on TikTok because I just wanted to be done with her, though I did say if I ever saw her in public, I'd run her over with my car. But that's, and I knew that she'd left the office. When I saw her, she was on Sawmill Parkway, and I didn't realize she'd opened the other office, back further on Presidential. And then probably 3 years ago, found out that she had blown up on TikTok and that kind of thing. And it was just, I just wanted to be done with it.
Sure.
And thought, anybody that sees her has got to be crazy. So.
Yeah. Well, tell me a little bit more. Take me back to that time period where you were basically having to give yourself antibiotics through an IV, you said. What was that like? I mean, that's not something everybody has to go through.
It was pretty awful. It was, so the infectious disease doctor, I remember, just kept saying like that I had multiple strains. Like it was just this weird combination, and he'd given me all kinds of oral antibiotics, like hardcore stuff that wasn't working. And finally, he, said that he was going to have to do a PICC line. So I had to go in. I don't know how familiar you are with this, but you go in, have to lay in it, and you can't move for 45 minutes, sterile field, and they run, I don't remember if it gets inserted at your wrist or but ultimately at your elbow, I think, and then they run a line to your heart. And so I had a permanent, IV port kind of thing, and then twice a day had to give myself this tube, like this big around of this, and it had to be refrigerated, and you take it out, and just like at first it made me really it made me sick, the thought of doing it, but also the medication made me sick. You can't shower, you can't wash your, you can't do anything. And through all of this, I was working. And so my boss at the time, I would call him, had just started a new job, and said, on like a Thursday, excuse me, and say, okay, I've got another infection. I'm having a procedure tomorrow. I'd have a surgery like on a Friday, recover for the weekend, and be back in the office on Monday. Because it was just like in and out. It wasn't, super invasive until the last, the one when I was in the hospital for a week. So.
Were you ever like laying in bed or a hospital bed thinking like, how the hell did I get into this? And like, am I gonna survive even? Because
Yes.
I feel like I would be.
Absolutely. Well, and I remember somebody said to me, it's when you think you've hit rock bottom and then you find out there's a basement. Like it was a dark time to be, it was, excuse me, just the thought of, I didn't want to do this to begin with. And I cannot believe now that I have had to go through all of this. And there were people in my life that I had a ton of support, but there are also people in my life that were like, why would you have surgery? Like, why would you just do that, if you don't have to? My mom died at 6 weeks before her 39th birthday with, and had 5 kids. And then I have
Breast cancer?
from breast cancer. I'm the youngest of 5, and my middle sister had breast cancer and survived. But it was like, just knowing all of those things, it's like, even knowing that, even knowing what I know, I still ultimately am glad I did it, because I didn't want to, I didn't want to have to go through chemo. I didn't want to, and once I started, I couldn't stop. Right. But here I was, and I look back and think how naive I was to like, I've thought about it more like, should I have done more checking? Should I have done more? But I trusted what people, I trusted what she was telling me, and was so enamored with, I'm going to wake up and be fine.
Sure.
And so I think I was pretty naive to begin with, but by a couple surgeries in, I realized, holy shit, this is a really big deal. And what if this can't ever get fixed?
Right. How did you feel? I guess you mentioned it was a dark time for you. What can you elaborate a little bit more, if you don't mind me asking? What was going through your head?
Well, I was in a relationship that was in the process of ending, that he didn't really support all of this. So that was kind of in the process of ending. I'm trying to start a new job, figuring out how I knew I could support myself, but okay, I've got to find a new place to live. I've got to find, like all of those kind of things, and have a new job. And how much is this going to take? Am I going to be able to afford it? Is insurance going to cover all of this? Because it was, it just kept going on, and it was hundreds of thousands of dollars. And what am I going to do if insurance can't cover this? How am I going to pay for this? What am I going to look like after the fact?
Sure.
And just all of that.
How did you feel when you saw what happened to her, or that she had her medical license taken?
ridiculously happy. Like I had a dinner with a couple friends planned that night. I bought us a bottle of champagne, and I mean, you hate to think. I mean, I hate to. I believe in karma, and I hate to like you deserve that, but damned if she didn't. Like the things that she did to so many people that are, whether they're disfigured, whether they're the traumatized, whether, I still see my oncologist. And when I saw her, it was like in February. So it was between when she'd gotten her license suspended and when she, ultimately lost it. And just sitting in my oncologist's office crying, thinking all these years later, still the hold that she has, like, it was like reliving it all over again, seeing what all these women had gone through.
God, I can't imagine. I'm really sorry you had to go through that.
Thank you.
Curious, did you ever file any complaints with the medical board or anything?
I did after everything came up again,
Sure.
Just so I could have it on the record.
Of course.
At the time when I tried to do a lawsuit and found out that it was too late because I waited until I was finally put back together.
Sure, till you were feeling okay.
Till I felt much more, my mental health was better, my physical health was better, and by that time it was too late. And I didn't have the energy to do a complaint at the time, and quite honestly, didn't think it would do any good. So.
That's fair. I've heard that from other people too.
Yeah.
So.
Yes.
You said you did eventually just.
I did once.
Get your stuff on the record.
Yeah, because once like people in the group and that kind of thing started talking about it. So it was in November. I think it was around Thanksgiving when she lost Yeah,
that's right.
When it got suspended. So it was around that time. And I talked to an investigator at the time. I talked to the attorney that I think for the state, just to get all of my facts out there. And I think I sent them my records too, just as they were compiling everything. And I remember the investigator at the time saying she'd never seen anything like this.
It's crazy. Man. What, we were talking about lawsuits, and it had been too long, unfortunately, for you to be able to file one. It's only like a 1 to 2 year window, so it is really brief. What do you think about that? Do you think that should be extended? There have been cases where if there's like a specific doctor or case like this who it comes out that he or she maybe did a lot of damage, that they temporarily extend it or create like a window for people to file even if it's passed. Would you like to see?
Oh, absolutely. Like because again, if they said that the attorney at the time said it was 1 year from when you should have known something was wrong. And he said, according to, his education, everything he knew about it, that would have been from like the first or second infection. And, so that would have been June, July of 14. And I probably didn't talk to him until 16 or 17 because, and my mental health was all I cared about was put me back together. I wasn't thinking about, oh, wow, there could be legal, repercussions here. It didn't even occur to me. So yes, there should be some way to measure it differently. That sure, when you should have known about it, but, is there all this other treatment and all these, there's always extenuating circumstances, and I know that's hard when it comes to the law, but yes, it needs to be different.
A lot of lawyers I've talked to, because I've done a lot of reporting on not just this kind of thing, but also doctors who might abuse their patients, say a lot of the time, patient doesn't even necessarily realize it, you're kind of saying, until later on, so.
Yep.
So how are you doing now?
Great, great. Married couple of years and a whole new life, a whole new, everything is good, but if the other thing I will say long-term is my right side is still an implant and I have to have MRIs every couple of years to make sure that that's still intact. And that's always a very traumatic thinking about it again kind of thing. And at some point, I'm going on 10 years and at some point that implant is going to have to be replaced. So the thought of that, of what if I get, what if that doctor isn't, everything that I think they are? What if this all happens again? So it's not that I think about it every day, but when there are things like that come up, it just brings it all up again.
Of course. That's got to be really hard to deal with.
So, yeah.
So it's obviously, Mary is a breast cancer survivor. You obviously had a mastectomy because of the BRCA genes. Is there anything that's sort of, I guess, it strikes me as a little sick or a little twisted that somebody like this is going after people who are, dealing with that kind of thing?
Yes. Yeah. I think that her ego just got I think that she, especially as time went on, everything that I've read about it, the other thing that I had heard about her. So when I had my surgery, let me think about this. I'm 55, so I was 46 at the time. She kept cutting back the age for people that she would do work on. So I think that ultimately she wouldn't work on anybody over 40, because of course the older you get, the more risk there is on, and the outcomes can be worse. So that was the other thing that I heard, is that she kept backing down the age of people that she would work with. So, I feel bad for these women who they just want to do a mommy makeover, give her all this money, and then, I think that it's really bad for both groups. It's you hate to compare or say that one's worse than the other. It's horrible for anybody. And I think she just got caught up in, I'm just going to do all these surgeries and make all this money, and it is what it is. Like, I'm not going to get caught. I haven't gotten caught all these years. Why am I going to get caught now?
Right. Did it surprise you to see that she was streaming some of these on TikTok and stuff? Or what did you think when you saw that? Because
that, to me, is crazy. First of all, I don't know who would watch that, but that's just my, and I can't imagine allowing it. And I don't think it's like she was giving discounts if you allowed it to be filmed. So I don't know why you would allow that. Just the privacy, the intimacy of that. I don't want to see that of myself. I don't want other people to see that. So I can't imagine why. And then, I'm sorry, I have to question why anybody would hire a doctor that they saw on TikTok. They have all these hundreds of thousands of followers. They must be a good doctor. How is that?
Yeah, I'm with you.
I think that says a lot about social media, and that's probably a story for a different day, but that's the power of social media is crazy. But yeah, I don't understand why you would allow that. And again, I think it goes to her ego of she's doing liposuction on somebody and looking at the camera. It was more important. That was more important, is that you're talking to the camera than paying attention to your patient. And it was that whole persona, and I know there was a lot of conversation during the trial and all of that of, oh, everybody created that persona. She's not, you never heard, nobody ever referred to her as Dr. Growie. She was Roxy. And she was every bit of that persona. And I think everything she did built it up. She did everything she could to increase that.
Have you ever had the chance to confront her, or what
no.
What would you say if you did, I guess?
If I saw her now, I would absolutely say, I am so glad you finally got what you deserved. In the back, before all of this, when it was all much more raw, I am quite sure I would have cussed her out and just, yeah.
Yeah, I can't blame you.
Yeah. So if I could share one more thing, interesting, an interesting positive on this, if I can share this. So my best friend of 30 plus years went to all of my appointments with me and all of that. The very last, what ultimately was my last appointment in Growie's office, they put me in a waiting room appointment room, whatever, I can't think of the word, that I'd never been in before. And on the wall, there was a sign that said, "Today I will choose joy." And I looked at my best friend and I said, take a picture of that. Like, I'm gonna need that. And that, like, it was the weirdest, like, I just knew it was gonna mean something. And strangely enough, I held on to that through all of this. Well, I have a new car now, but my license plate is Choose Joy. I have like all kinds of, like that sign, worry is the thief of joy. And I tried to, through all of this, find the joy in it and think, okay, there is a lesson in this, and I figured out, like, when you think you cannot go through anymore, and it's just more and more and more, and I survived. So there's a sign that says joy. Like every room of the house, you'll see joy, because it's a choice. And if I didn't make that choice, I never would have survived it.
I get that.
So that's the rest of the story.
That's great. That's great. And I love that you have all the signs and stuff. It's clear.
So as much as I hate that that's tied to her, there is also that I survived her.
Mm-hmm. Absolutely. I guess so when I reached out to you, what made you want to?
Because I want people to know how long this has been going on. This was going on when she was Dr. Growie. This isn't just about Roxy. Roxanne Growie was a doctor for a long time before she was Roxy. And she heard Mary Jenkins as Growie. She heard, you know what I mean? Like, there were people long before she was ever Roxy. So it just took that long to catch up with her.